The group of substances that has been extensively investigated is a so-called tyrosine kinase inhibitors or kinase inhibitors, which block proliferation activities of the leukemia cells. And amongst those, sorafenib and midostaurin are the drugs that have been shown to significantly prolong relapse-free survival, and in the case of midostaurin also prolong overall survival in younger patients when combined with chemotherapy. But there are other groups of drugs that are currently tested in clinical trials, such as BCL2 inhibitors, venetoclax for instance, monoclonal antibodies against CD33 or against CD123. There are other immunotherapies, such as the use of CAR T cells, and some other group of drugs as well, some other groups of drugs as well that are in clinical development. Such as smoothened inhibitors or nutlins. There's a whole range of different new drugs. I do think the data with midostaurin in combination with standard chemotherapy are as promising that I expect this will result in licensing the drug for clinical use, which means midostaurin could come or could be available for patients as standard of care if those patients have an FLT3 mutated AML. With other drugs, I do think that other tyrosine kinase inhibitors that are more targeted, that have less off-target effects than midostaurin or sorafenib have, that these can make their way into the clinics as well. And if we see profound benefits in terms of overall survival for other drugs, they could be part of a standard routine regime as add-on to chemotherapy.